you want to speculate on death in bed?
Okay. The term dead in bed has been used actually since I was a child to describe the relatively infrequent but not unheard of occurrence of type 1 diabetic children found dead in bed in the morning. And the speculation usually is that they died of hypoglycemia overnight. And that would be my guess too. I guess occasionally you have someone who has both diabetes and another ailment like a congenital heart anomaly or something like that. But I think that indeed there are type 1 diabetics who don't survive the night because they get hypoglycemia, which is the reason that I insist that my pediatric diabetics wear a continuous glucose monitor. And those who cannot afford it have to have a parent coming in every few hours to check their blood sugar, even if they're on our regimen. Now, if they were on the ADA regimen, where their entire life is a roller coaster of blood sugars going way up and way down, the odds of dead in bed are much greater, and the need for continuous monitoring or frequent awakening is all the greater. Nowadays, there's probably little in the way of excuse for this thing. You have the continuous glucose monitor, and that plus the kind of attention that you're giving your son, and I'm not talking about going into his room in the middle of the night, just putting him on a regimen that keeps him level is going to reduce the likelihood of plummeting in the middle of the night. You have to be doing something wrong to make a blood sugar plummet in the middle of the night. Now, most of what's done under standard conventional regimens is wrong, and will do something like that. They're dealing with very large industrial doses of insulin, over which they have no control. And of course, huge amounts of carbohydrate. So dead in bed should become unheard of, but it's still going on amongst those people who are following standard guidelines.